hands with water. Apply soap, rub your hands palm to palm, and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub, and then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Coronavirus is most likely to spread from person to person when we come into close contact with one another. We can all help stop the spread by keeping our distance. This means do not shake hands or exchange physical greetings, and wherever possible, stay at least 1.5 metres away from others. It's also really important to practice good hygiene, especially after being in public places. Together, we can help stop the spread and stay healthy. Visit health.gov.au to learn more. Authorised by the Australian Government, Canberra.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.